Hi, I'm Dr. Yadhu Lokanath. I'm a consultant neurosurgeon and spine surgeon at Aster RV Hospital. Today, I'll be talking about one of the commonest symptom, that is neck pain. So, neck pain is a commonest symptom we see among teenagers, adolescents, elderly population, and of course, the geriatric population also complains of neck pain. So, to start with, what is exactly a neck pain? So, neck pain is an unpleasant sensation or a sensation of discomfort in the region of neck, which involves radiation to the one or both the arms. So how often it is seen, or who is more commonly affected? Of course, the females are more commonly affected than males. At a given point of time, around 10 to 20% of the population have neck pain. Around 54% of the population have neck pain in the last 6 months. But why the neck is prone more to injury? The neck is a vital component of the human spine, which helps in assisting movements more frequently yes and no, or right and left. Along with this, it supports the head torso. So these functions, the main yes and no or the vital functions, make this neck more prone for injury. So what are the common causes of neck pain? The common causes to start with include overuse or misuse of your spine, that is muscle spasm or a muscle sprain, we can say. This is the first most common cause, following which the wear and tear, that is the degenerative spine, which occurs as a part of aging process, which can cause narrowing of the spinal canal or can predispose to slip disc or a cervical spondylosis. The other causes include the developmental anomalies, that is the developmental or the acquired anomalies which manifest in the teenagers or the adolescent period. The other causes include whiplash injuries, that is a neck injury following a trauma where your neck is brought front and back, and usually this happens during a road traffic accident. Torticollis is one of the other cause also. So with these things in background, what are the symptoms? How usually they can present with? They can present with an axial neck pain, which just involves the pain in the neck or coming down. Next is the radiating pain, which involves pain coming down to the arm, hand, under the fingers, or to the back, the scapular area also. They can have some kind of tingling and numbness in the hands, on the fingers. They can have painful neck movements or a sore neck when they turn to one side or other side. And next common cause is difficulty in doing the daily activities like gripping a pen, buttoning or unbuttoning a shirt, or holding just a fork. Sometimes patients do come with an history that I cannot sign, my handwriting has been changed. Other things include weakness in the legs, difficulty in walking, imbalance, gait disturbances, and most commonly the new recent trend is neck pain associated with headache, called as cervicogenic headache. So these are the few common symptoms, and in some advanced cases, patients who are neglected, they can even come with loss of bladder and bowel control, that is difficulty in controlling their urination or urgency or something of that sort. So with this, what are the red flags? When do you have to visit us? Is there anything to panic? There's nothing to panic, but you need to visit us at the right time so we can give a right treatment at the appropriate point of your illness. So what are the important tips when you should visit us? So neck pain which is radiating, or isolated neck pain which is beyond 3 days, which is consistent or worsening, which is not relieved by any medications or rest, or of course a short period of physiotherapy. The first thing. Second thing, weakness, that is weakness in the legs or in the hands in the form of loss of strength, loss of sensation, or sometimes wasting, called as thinning of any of the upper limbs or lower limbs. As I mentioned, the loss of your bowel or bladder control, painful neck movements, or the infective constitutional symptoms like night sweats, fever. These are the things. And the last thing is, if you have a neck surgery in the past and you're having a neck pain after next, these are the few important we can term as red flags. So moving on to prevention. Preventive aspects are like when you have a small muscle tear or a muscle spasm, give rest for a few days, start with physiotherapy. First and foremost thing is important posture while at work or at home. So proper ergonomics has to be taken. Avoid falls. So this is the most important thing. And third most common thing is you can take over the counter medications like analgesics, muscle relaxant, or cold and hot compressions. And the last thing is, when these conditions are not subsided with the above conditions, you need to visit us for further investigation, a form of imaging modalities, to know what exactly it is. So we at Aster RV Hospitals are equipped with all facilities to diagnose your neck pain and give the exact treatment for your nature and cause of treatment, so the neck pain can be prevented in further episodes and the exact treatment can be given. Thank you.